Hello and welcome. Thank you for joining me on this very special topic. I put this presentation together to help those who are caring for the elderly population get a better idea and understanding of how to nourish their loved ones. Whether you're a caregiver, staff member, or a volunteer at a long term care facility, ensuring that the nutritional needs of our cherished residents are met is very important. As a dietitian, I've seen firsthand the impact that proper nutrition can have on the health and well being of individuals in long term care settings. That's why I'm passionate about sharing this knowledge with others so that we can work together to provide the best possible care for our residents. In this training, we'll explore key principles and practices that can help ensure safe nourishment for the residents, from understanding the unique nutritional needs of the elderly population to implementing strategies for safe feeding and mealtime management. We'll cover a range of topics designed to empower caregivers and volunteers alike. One of the most important aspects of this training is collaboration. By working together as a team, we can create an environment where our residents receive the support and care they deserve. Whether you're a dietary aide, nursing assistant, or a recreational therapist, your role in promoting proper nutrition and hydration is invaluable. Together, we can make a difference in the lives of our residents. So, a little bit about me. I am a registered dietitian. I've been a dietitian for almost 2 decades now. During these years, I had the privilege of gaining experience working with all sorts of health journeys, patients living with cancer, undergoing surgery, struggling with autoimmune disorders, diabetes, gut disorders, infertility, you can name it. Since 2005, I have also taught, conducted clinical research, and presented at various nutrition workshops. Currently, I work at a beautiful long term care facility where we are all about providing excellent care for our residents. That's why I put this presentation together, this training together for our incredible staff and volunteers. So, just starting with a short disclaimer, the information here is provided for informational purposes only. It is not intended as a substitute for the advice provided by a licensed physician, a registered dietitian, or other healthcare professionals, or any information contained on or in any product label or packaging. So, please do not disregard professional medical advice or delay in seeking professional advice because of something you hear in this presentation. So here it is. Here is the beautiful facility that I work at. As you approach the vineyard's residence, your eyes are greeted by the expansive beauty of the vineyards. The rolling hills and lush greenery in spring create a picturesque backdrop, inviting a sense of peace and calm. At the Vineyards residence, we think you'll be surprised and delighted with our approach to senior living. We believe every person is defined by so much more than just their care and support needs. We believe that living in a beautiful residence that provides customized support can allow people to go about life as they always have, despite experiencing changes to their mobility or their cognition. At the vineyards, you can create the life you want to live without the hassles associated with home maintenance. You can host family and friends, you can build new relationships, and you can rediscover and embrace new passions and experiences. The vineyards provides a wonderful escape for both residents and guests, offering an exceptional senior living experience in the beauty of wine country. We believe that life is better here. So, I would like to start the first part of the three-part series with a special thanks to my colleague Christina for her invaluable support in providing some of the resources that contributed to the development of this presentation. I am truly grateful for her and I'm honored to have had the opportunity to work with her. This presentation is mostly built on the guidelines from ITSE, or International Dysphagia Diet Standardization Initiative. If you're not familiar with ITSE, they provide essential guidelines for managing dysphagia or difficulty with swallowing, and they make sure safe and enjoyable eating experiences for different ages and different groups. So today we will be talking about importance of hydration, nutrition, and overall health maintenance, changes in eating for older adults, including factors affecting their habits, nutritional needs, and common challenges. We'll talk about swallowing difficulties in long-term care, the risk associated with it, and understanding the process of normal swallow, the negative impact of aspiration and choking, the causes, the signs to look for, and how to respond. And then we dig deeper into the reasons and causes um, uh, that are associated with swallowing difficulties. We will talk about proper positioning, equipment, types of feeding assistant, and food textures in the second and the third part of this presentation. Uh, so, we all know that meals are an important part of the day. People eat 3 or more times a day, and we have many social and cultural practices around eating. Meal times in long term care are especially important as they are one of the main activities happening in a resident's day and contribute to their quality of life. Making sure a resident eats and drinks enough is an important part of maintaining their health. Also, our long term care residents have unique risks and needs around eating, which make it an important time for protecting their health and well being. In any long term care setting, ensuring residents receive adequate hydration and nutrition is important for their overall well being. Here we'll talk about the various benefits of keeping residents hydrated and well fed, highlighting the crucial role these factors play in promoting their health and quality of life. So, adequate hydration and nutrition strengthens the immune system, helping residents fight infections more effectively. They play a pivotal role in preventing skin breakdown and pressure sores and the healing process if they happen, preserving resident skin integrity and comfort. They the energy from good food, good hydration can help residents build strength for daily activities and movement, which foster independence and overall physical well-being. It also support improved mental health, mental alertness, enabling our residents to stay engaged, focused, and mentally sharp throughout the day. Well hydrated and well fed residents often experience enhanced overall mood, contributing to a positive and uplifting atmosphere within the care facility. So, by addressing hydration and nutrition needs, caregivers can significantly improve both the quality and quantity of residents' lives. So we see a lot of changes in eating for older adults, and there are many reasons for that. That there are many reasons that contribute to this problem. As we age, we may experience a decline in muscle mass due to reduced physical activity levels. This can lead to a decreased appetite as the body requires fewer calories to maintain muscle mass. Residents may not feel hungry or thirsty even when they aren't eating or drinking much. Aging can affect the body's hunger and thirst signals, causing residents to feel less inclined to eat or drink even when they may not have consumed enough throughout that day. Then we see the changes in taste perception that can occur as a result of aging and medication side effects, leading to food tasting bland or unappealing, which can significantly impact residents' desire to eat. And similarly, changes in sense of smell due to aging or medication can alter how food tastes, further diminishes the enjoyment of meals, and reduces appetite for them. Declining vision can make it challenging for residents to see food on their plates. That affects their ability to visually enjoy meals and potentially reduce their appetite. Mood changes or cognition decline, which we see a lot in this population with dementia or stroke survivors, can impact the desire to eat and interfere with the eating process. Then we have the dental issues, such as the use of dentures, or the dentures are not fitting well, or missing teeth can make chewing foods difficult and uncomfortable, leading to decreased food intake. Dry mouth is a common issue among the elderly population, and that can be caused by dehydration, side effects of some medications, or certain medical conditions, which make it harder to chew and swallow food. Weakened muscle strength, particularly in the mouth and throat muscles, can make chewing, swallowing, and transporting food to the mouth more challenging, and that impacts overall food intake. So, aging can slow down the digestive tract in general, and that leads to indigestion and heartburn, which may contribute to decreased appetite. Up to 40% of residents in long term care may have dysphagia or difficulty with swallowing. This can lead to them not eating or drinking enough and losing weight or muscles or becoming dehydrated. It can also lead to aspiration, choking, or pneumonia. So, swallowing is not as easy as it sounds. It is a very complex process which someone who has a normal swallow may not have thought much about it. This is because of the fact that half of the process is automatic and the other half is something we do multiple times a day. But there are actually many steps to it and many ways it can be affected. So let's do an activity together. If you are somewhere that you have access to food, go grab a piece of food or fruit or crackers or leftovers, whatever you have handy, and let's chew and swallow together as I walk you through the different stages and steps. So, while you're chewing, I'm going to talk about this whole process of swallow, which most of us take for granted and may not appreciate the complexity of it. So, during a typical swallow, food and liquids journey through the mouth into the esophagus. And you see esophagus on this picture, the long tube that goes down the throat. That is guided by a precise series of muscle movements. To understand this process better, scientists developed a four-stage model. So let's take a closer look at each stage. First, in the oral preparatory stage, food is kept at the front of the mouth where it's mixed with saliva and chewed into a softer consistency. Then, in the oral transit stage, the tongue pushes the food to the back of the mouth while the soft palate closes off the nasal passageway to prevent any food from going the wrong way, going down the wrong tube. Next comes the pharyngeal stage, a rapid activity where the food is propelled into the esophagus. This involves the elevation of the larynx and the protective flip of the epiglottis. And again, in this picture, you see epiglottis that is colored in blue. The muscles in the throat contract, pushing the food downwards, and the upper esophageal sphincter opens to allow passage of the food into the esophagus. Finally, in the esophageal stage, the food moves down the esophagus towards the stomach, propelled by coordinated muscle movements called peristalsis. Just imagine these muscles contracting and relaxing, pushing the food down. The upper esophageal sphincter closes to prevent any food from coming back up to the esophagus. If there are any issues or coordination problems during these stages, it can lead to difficulties like choking, aspiration, or the inability to swallow. I will put two links in the comments below for you to watch a very helpful video that guides us through this whole all of these stages of swallowing, and then another video that helps us to understand what goes wrong when we have difficulty swallowing. So in a typical swallow, food and liquids glide seamlessly from the mouth to the esophagus, and that's because of the precise orchestration of muscle movements. As swallowing activity begins, the epiglottis swiftly descends. That safeguards the airway basically, while the upper esophageal sphincter opens its gate, ushering sustenance, ushering our food into the esophagus. When the passage is clear and the way is clear, the sphincter seals shut, ensuring no food strays back into the throat. At the same time, the muscles in the esophagus engage in a rhythmic contraction. So they contract, they relax, propelling food downwards through a wave like motion. When it comes to swallowing difficulties, or known as dysphagia, they often manifest as either physical or functional impediments. Physical obstacles such as enlarged tonsils or tumors pose challenges primarily with solid foods. And then we have the functional deficits, which may involve uh, the other muscles that are involved in the opening during a swallow, or their failure to widen adequately, resulting in basically hiccups with both liquids and solids coming back. Treatment strategies commonly entail thickening liquids or adjusting diets to ease swallowing problems. And we will talk about how to adjust the texture, how to thicken liquids, and all of that. It's very important to note that while these insights offer valuable guidance, dysphagia has a lot of complexities, and of course we don't only see it in elderly population, but these are some of the common ones. Again, I highly encourage you watch the two videos that I'm putting the link in the comments below to help you follow the movement of these muscles and what could potentially go wrong at each of these stages. And of course, as always, please reach out if you have any questions with that, and for any of the things that we are about, any of the things that I'm sharing here with you. So, aspiration can trigger coughing fits, potentially straining muscles and causing discomfort for residents. Food or fluid entering the airway can lead to shortness of breath or a feeling of drowning for the resident. Aspirated food, the food that's got stuck, or fluid, provides a breeding ground for bacteria that increases the risk for developing pneumonia. Aspiration of food may also result may in choking, posing immediate danger to residents' respiratory health. Uh, the consequences of aspiration can be very severe, potentially leading to hospitalization or even death, highlighting the critical importance of preventing these episodes. So, choking is one of the leading causes of death in adults over the age of 85 in Canada. That's a very scary stat. Choking is when a food or fluid goes down into the airway. We talked about aspiration, so it's basically aspiration means food or fluid goes down into the airway instead of esophagus, the food way, and causes a partial or total blockage, preventing air from getting into the lungs. In partial choking, the airway is not completely plugged. some air is able to get past. In this kind of choking, a resident will make noises such as coughing, gagging, wheezing, or retching. Their body is trying to push the block out of the airways, and some air is getting past, so it is audible. This kind of choking may become a complete choking episode if the blockage slips further into the airway and plugs the airway completely. In complete choking, the airway is fully plugged. This type of choking is silent since no air is able to get past the blockage to make noise. So, this is very important. Watch for signs of this type of choking, such as dropping utensils, grabbing at the neck, abrupt movement, grabbing at chair arms, face or fingertips turning blue. It is a good idea to do a quick visual scan of the dining room every few minutes, as many of our residents aren't able to communicate if they are choking, and especially if it's a silent one. These are some of the factors behind swallowing challenges. The residents experiencing weakness or paralysis in their arms or hands may struggle with tasks such as holding utensils or bringing food to their mouth that impacts their ability to eat independently. Tremors in the arms or hands can lead to difficulties with precise movement required for eating, making it challenging to control utensils or maintain food on utensils. Um, then, conditions such as stroke or neurological disorders can disrupt signaling from the brain to the muscles involved in chewing and swallowing, resulting in ineffective or slow swallowing reflexes. Then we briefly talked about missing teeth, ill fitting dentures, or weak jaw muscles can impair chewing ability, making it difficult for residents to break down food properly before swallowing it. Residents may have reduced sensation in the mouth, leading to difficulties detecting food particles or knowing when their mouth is adequately clear of food. Difficulty moving the tongue can hinder the manipulation of food within the mouth, affecting the chewing and swallowing process. Challenges in sealing the lips can result in food or liquid escaping from the mouth during eating, leading to messy and inefficient feeding. Uh, we mentioned dry mouth or xerostomia can be caused by various factors like medication side effects or medical conditions, making it uncomfortable to chew and swallow food. Slow or spastic contractions of the esophagus or narrowing due to medical reasons or scar tissue can impede the smooth passage of food from mouth to the stomach. Dysfunction of the epiglottis, the flap of tissue that covers the airway during swallowing, can lead to food or fluid entering the airway, increasing the risk of aspiration. And residents lacking a gag or cough reflex due to muscle weakness or decreased sensation may not be able to protect their airway effectively during swallowing, and that would increase the risk of aspiration. Uh, Certain medications can affect consciousness, can affect sensation, can affect muscle function or saliva production, and all of that contribute to swallowing difficulties. Then we have the respiratory conditions, which may cause shortness of breath while eating because swallowing temporarily interrupts breathing. It pauses, very short pause, posing challenges for residents with compromised respiratory function. So, as we mentioned, they're all at risk for difficulties or with swallowing or dysphagia. Um, Residents experiencing dysphagia may exhibit coughing, choking, or retching during or after swallowing, indicating difficulty in safely moving food or liquid from the mouth to the stomach. Dysphagia can lead to difficulty managing saliva, resulting in excessive drooling, particularly during meals or when they attempt to swallow. Residents with dysphagia, difficulty swallowing, may vocalize complaints of discomfort or difficulty while eating, expressing sensations such as food getting stuck or feeling pain while swallowing. They may refuse to eat or show poor food intake due to the discomfort or fear associated with swallowing difficulties, and that can lead into inadequate nutrition and hydration. Sometimes a wet or gurgly voice after eating may indicate residue or pooled saliva or food in the throat. That's a common symptom of dysphagia. Residents may hold food in their cheeks rather than swallowing it, a behavior known as pocketing, which can indicate difficulty in initiating or completing the swallowing process. Dysphagia can also prolong the time it takes for residents to consume a meal, to finish their meals, as they struggle with chewing and swallowing, and that leads to extended meal durations. Um, if you observe a delayed or absent swallow reflex where the resident appears to have difficulty initiating the swallowing process or fails to swallow altogether, know that that's a key sign of dysphagia that requires further assessment and intervention. So please reach out to the speech language pathologist, to the dietitian, or whoever the main clinician responsible for this area of care is. The next part of this presentation, we are going to talk about ITSI, International Dysphagia Diet Standardization Initiative, and how we can modify different food and fluid textures to help with dysphagia problem in the elderly. They have this problem. So thank you for joining me for this first part. Please come back for the second part as we go into more details about the different textures. See you there. Bye bye.